right, so now we are 3 weeks out from minimally invasive bunion surgery.
Dead skin.
Yeah. Taking the wrapping off. Great. Great. I'm going to push on your foot. That looks wonderful. So you were an interesting case because you had a bunion surgery done by another provider, and you can actually kind of see the previous scar, which was pretty much from, here's the beginning of it, all the way to here. And then with the minimally invasive surgery, the incision was here, here, and a small incision right here, which is right there. If you don't mind, forget about the minimally invasive surgery for 1 second. What was surgery like, the traditional bunion surgery that was done by a different provider? What was that experience like?
Basically, I was cut open. I could not put any weight on it for 4 weeks.
4 weeks, no weight?
4 weeks, and more pain. This was just totally much better recovery. And I don't know, with the other, it was, I don't know how to describe it. Like I was on a pain pump, you know, this, nothing.
Oh, you were on a pain pump after the bunion surgery,
yes.
the traditional open bunion surgery?
Yes.
Oh my goodness.
Yeah.
That's very painful if you have to be on a pain pump.
Yeah. But this was nothing like that. I mean, Advil, Aleve, anything like that would do the trick. Because
this was a revisional surgery, so your bunion came back after the first surgery that you had done elsewhere. So we're 3 weeks out. Can you talk to me about how was the surgery itself like and the recovery?
The surgery, of course, I had to be awake because I could not be put to sleep, which was a little different because you just gave me shots to numb my foot. But I didn't feel anything. What I did feel was just pressure. Recovery's been a lot better. I mean, after 48 hours, I was well, even 48 hours, I was walking on my heel.
Yeah.
And after that, I've been walking as I'm able in my shoe.
So you've been walking for the past, I mean, pretty much right after surgery, you've been walking. And there's no screws, no plates in your foot.
Which is awesome.
Yeah. And small little incision sites.
Which I had a huge one before.
You can, I mean, previously the incision was about that big. And now we're down to these little poke holes.
Yeah.
Great. Overall, have you had a good experience with minimally invasive surgery to fix your bunion?
Very much so. I would recommend it to anybody.
Well, that's what I was going to ask. If there are other people that have bunions and minimally invasive surgery is an option for them, would you recommend going this route?
Definitely.
Great. Well, thank you for telling us about your experience.
You're welcome. Thank you for what you've done.
Oh, it was my pleasure. Happy to help.